Madam Chair, and thank you to all of our witnesses. Nice to see some familiar faces here. If I may, I'm going to actually address this question to two groups, so I'll give one person a chance to think about it. The other person will have to answer it right off the hop. Sarah, may I call you Sarah? Yeah. Michelle, may I call you Michelle? The question, and I'll start with you, Sarah, is I think we've made great strides in convincing people to not be afraid to ask for help. So now we have a lot of people who have overcome that hump. They're ready to ask for help, in particular children or parents of children. So they're ready to access help. They take that brave, courageous step, and then there's nothing there for them when they do ask. What is the number one thing we can do as a federal government to close that gap to access to treatment for mental health supports?
Thank you, Madam Ferrari, for that question. I couldn't agree more. We've done so much great work on raising awareness, breaking down stigma, and addressing this discrimination associated with mental illness and substance use health. But the challenge really is in where do you go for help? We shouldn't have a country where in order to get the help that you need to be in crisis. And crisis means going to hospitals to get the care that you need. We need to have more cost-effective and community-based care. And the role of the federal government is, in my opinion, directing resources to provinces and territories to fund community-based organizations. So that's that out-of-hospital care that people rely on in community. It's culturally appropriate. It's trauma-informed. It's age and gender-sensitive. It's integrated youth hubs, for example. So really it's about ensuring that we're allocating those federal dollars, both through the health funding that is transferred to provinces and territories, and then direct investment through grants and contributions from federal departments to those community-based organizations doing that work.